So we started respiratory system. In that we have discussed upper respiratory system, nose and nasal cavity, pharynx and larynx. Now we will discuss about larynx. Basically, the larynx, what are larynx? Larynx is also called voice box. So, uh, I am talking, okay, I am delivering speech, I am able to speak few words, few sentences. I am able to teach everything with the help of voice box. Okay. So from that area, the voice is coming. Okay. A name that indicates one of its function, which is speaking. The other functions of larynx is to be an air passageway between the pharynx and trachea. Larynx have two functions. Okay, basically, one is speaking, one is passage area of air. Air passages must be kept open at all times, and so the larynx is made of 9 pieces of cartilage connected by ligaments. Cartilage is a firm and flexible tissue that prevents collapse of the larynx. In comparison, the esophagus is a collapsed tube except when food is passing through it. So basically here, uh, larynx. Larynx is having one continuously function, that is the passage of air. Okay, because we need oxygen 24 by 7. Every time we need, every minute we need oxygen. So that's the reason the larynx is to be kept open. Okay, but another function is speaking. So for the smooth functioning of larynx, naturally God made larynx with help of with the cartilages, because cartilage is very flexible. Okay, so it cannot be breakable, it cannot be damaged very uh, easily. Okay, so it is the good sign of cartilage. So they have cartilages. Number of cartilages are there. You can see that here we have epiglottis. One cartilage is, so basically how many cartilages are there? 9 cartilages. So in the 9 cartilages we have epiglottis. Okay, this is the bone, hyoid bone. With the help of hyoid bone only the ligaments are attaching. And we have thyroid cartilage. This is the thyroid. Also gland, there is gland also. And we have vocal cords here and cricoid cartilage. This is the cricoid cartilage where the parathyroid glands are there. And we have brachial cartilages. Okay, so these cartilages help the larynx to keep open. Okay, so the largest cartilage of the larynx is thyroid cartilage, which you can feel on the anterior surface of your neck. The epiglottis is the uppermost cartilage. During swallowing, the larynx is elevated and the epiglottis closes over the tongue, rather than like a trap door or hinged lid to prevent the entry of saliva or food into the larynx. So basically, we have epiglottis. So this is the epiglottis. So basically, whenever the food we are eating, while entering the esophagus, the epiglottis close the airway, means larynx. Okay. So the entry of food is restricted with the help of epiglottis. Okay, this is the very, very important thing you have to remember. So what will happen whenever the CNS damage happen? So most of the part of the swelling is damaged because the area in the brain which is giving reflexes, okay, is damaged. So damaged area means cannot able to swallow anything. Okay, and the epiglottis cannot close properly. So that's the reason the food in the will in the mouth will enter into the trachea. So when the patient is having cough, reflex cough, okay, the mucosa of the larynx is called ciliated epithelium. So there is mucosa to thickening because of the mucosa only. The when the air enters, most of the bacteria are trapped, except for the vocal cord. But the vocal cords have stratified squamous epithelium. The cilia of the mucus sweep upward to remove mucus and trap dust and microorganisms. Okay. The vocal cord. Here we have the vocal cord. Okay. In the larynx, we have vocal cord. This is the vocal cord where the voice is coming. The vocal cord are on either side of the glottis, the opening between them. During breathing, the vocal cords are held at the sides of the glottis so that air passes freely into and out of the trachea. During speaking, the intrinsic muscles of the larynx pull the vocal cords across the glottis. And exhaled air vibrates the vocal cords to produce sounds that can be turned into speech. So here, which help to speak, okay, the vocal cord will producing the voice, but whenever the air vibrates the vocal cords to produce sounds, it will turn into the speech. Okay, so how it is possible? But this is not. It is also physical possible to speak while inhaling, but this is not what we are used to. The cranial nerves that are motor nerves to the larynx for speaking are vagus and accessory nerves. You may also recall that for most of the people, the speech areas are in the left cerebral hemisphere. So basically, uh, the speech area in the brain, which is giving the information to the vocal cord to bring the voice, is present in the left side, left hemisphere. Here we have the speech area. Okay, when we have speech area, the nerves which are giving the which is helping the speech, that is vagus and accessory nerves. So we have to remember there are 12 cranial nerves in that. Vagus nerve and accessory nerves are helping to speech. So we have to treat whenever speech is not coming, means here any problem is there, or on the nerves or local area. So we have to treat all these three areas whenever the speech is damaged. Okay. So I think understood about larynx. So this is all about larynx. Larynx is very important because of the speech, because of the air passage. So these are the two things you have to remember. Next we have trachea and bronchial. So we are going down. So you can see that this is the larynx, the uh, okay, superior view. This is the glottis. This is the trachea. Okay, this is the vocal cord, epiglottis. Okay. Next, we are talking about respiratory tract. We all talk about in the area. This is the upper respiratory. This is the lower respiratory tract. What we call already studied about. These are the lower respiratory tract. So the lower respiratory tract is chest cavity, the lower trachea and the lungs. Lower trachea and the lungs. So we have the lower trachea and the lungs. So this is till now we talked about that. Okay. Till here. Now we talk about trachea and whole lungs. The trachea is about 4 to 5 inches, means 10 to 13 centimeters long and extended from larynx to the primary bronchi. The wall of the trachea contains 16 to 20 C-shaped pieces of cartilage, which keep the trachea open. The gaps in this incomplete cartilaginous rings are posterior to permit the expansion of the esophagus when food is swallowed. The mucus of the trachea is ciliated epithelium with goblet cells. As in the larynx, the cilia sweep upward towards the pharynx. So basically, so this is the trachea. Okay, this is the trachea. This is 10 to 13 centimeters. First thing. And we have, these are the lines. Okay. Okay, these are the lines made up of C-shaped cartilages. So why we have cartilages? Because the trachea is always open, but in that some areas having uh, tissue. Okay, because whenever esophagus is expanding, so it will uh, connect. It will some sort of place will given to the esophagus. Okay, so this is the esophagus. So air entry will be easily possible through the trachea with the help of these cartilages. So that's the reason we have cartilages. Okay, and we have in the trachea we have the mucus. Mucus is made up of ciliated epithelium, and they have goblet cells. Already to study it in the immune system, the goblet cells, what the function of the goblet cell. Okay. Next, we have bronchi. So next is we have the bronchi. This is the lobe. You can see this is the right side of the lung. This is the left side of the lung. Okay. So in that we have three lobes. Okay, this is the lung lobe. This is the second lobe. This is the in the left lung we have only two lobes, and this is the cardiac notch. Here the heart is situated. Okay, so this is the diaphragm. That diaphragm is very important. Okay, this is the upper respiratory. Sorry, this is the upper lobe. This is the lower lobe, and this is the middle lobe. This is the middle. This is upper. This is lower. This is the upper lobe. This is lower lobe. Okay, right lung, and this is the trachea, and this is the bronchi. All the areas. The right and left primary bronchi are the branches of the trachea that enter the lungs. Their structure is like that of the trachea, which C-shaped cartilages and ciliated epithelium. Within the lungs, each primary bronchus branches into secondary bronchi, leading to the lobes of each lung, three right to left. The further branching of the bronchial tubes is often called the bronchial tree. So basically, so here we have the bronchi. So this is the trachea. So trachea is dividing here one, two, and here this is the primary bronchi. What we call primary bronchi. Next, you have the secondary bronchi, also called tracheal tree. Like the tree have the all the branches. They have the leaves, flowers, everything. So likewise, here we have the all the branches in the primary. Primary is attached to secondary. Here we have the only one branch. You can see here. Next, we have secondary branches are there. Primary is one only here. Here, primary you have two branches. Okay. So bronchial tube. Imagine the trachea as the trunk of the upside down tree with extensive branches that become smaller and smaller. These small branches are the bronchioles. So next is last, we have the bronchioles. You can see this. This is the bronchioles. All these branches, ending branches are called bronchioles. Okay. No cartilage is present in the wall of bronchiole. Bronchioles doesn't have cartilage. This becomes clinically important in asthma. The smallest bronchioles terminate in clusters of alveoli, the air sac of the lung. So smallest bronchi is attached to the alveoli. This is the lungs. Lungs, smaller part, lungs, smallest cell. So this is called alveoli. So from that alveoli, the air enters here, goes, leaves. Okay. So this is very important bronchi. So primary bronchi, secondary bronchi and bronchi 3 or bronchi. Next is bronchioles. Next is here we have one thing we have to remember. So likewise, this is the lungs, but lungs is covered by one layer. One layer. So this layer is called pleural membrane. We have the two layers. We are going to see that this is the one layer. Okay. Next we have the here was the second layer. Okay. And in that place we have the space, that is pleural space. Okay, this is very important. Now we are going to start about lungs and pleural membrane. The lungs are located on either side of the heart in the chest cavity and are encircled and protected by the rib cage. So upper side we have rib cage. Rib cage protects the lung from collapsing whenever we fall, whenever anyone hit us, any damage occurs on the chest cavity. What will happen? It will protected by rib. What happened? It will protected by rib. The base of each lungs is rest on the diaphragm. So here we have the diaphragm already. I told you. So this is the diaphragm. This is the diaphragm. You are seeing that this layer is given here. You can see here. This is also diaphragm. Okay. So this is the diaphragm. The apex superior tip is at the level of clavicle. On the medial surface of each lung is indentation called the hilus, where the primary bronchus and the primary pulmonary artery veins enter the lung. So here we have the one thing. This is the clavicle bone. Here the upper lobe is ending at clavicle bone. Till here we have the lungs. Okay. Till here we have the lungs. So where the arteries, pulmonary veins, pulmonary nerve entering, we will call that area as hilus. Hilus, where the primary bronchus and the pulmonary artery veins enter the lungs. Now, pleural membranes are the serous membranes of the thoracic cavity. We have the parietal pleura, visceral pleura on the surface of the lungs. Chest wall and the vessel process of the lungs. Between the pleural membrane, serious fluids which prevent the friction and keep the two membrane together during breathing. So here we have the visceral pleura. So pleura, so this is the one covering of the lungs, and it is the one covering of the lung. So this is the viscera and this is the parietal pleura. In that we have the fluid, pleural fluid. Pleural fluid is for the protection of the lungs. Protection, when you are expanding, you have the ability to damage. Okay, so that's the reason the pleural cavity, pleural fluid is there, which protects the lungs from damage. So whenever infection occurs, so what will happen? This pleural fluid is damaged. So here we have the infection. Pleural effusion will occur. Sometimes the water enter into the lungs, it will become pneumonia. Anything will happen. That's like the lungs have infection. Next, we have the alveoli. This is the smallest functional unit of the lungs. So understood here, very, very important, the pleural fluid, pleural space, visceral pleura, parietal pleura. Very important, very, very important. We have to remember, because from that area only we have number of infections will enter to the lungs. Then the infection will damage the lungs, and the patients have a lot of problems like emphysema, pleural effusion, pneumonia, everything will happen. Next, we will talk about alveoli. Alveoli. Now we will talk about alveoli. Alveoli is the functional unit of lungs. The flat alveolar type 1 cells that form most of the alveolar wall, simple squamous epithelium. So basically, the first, which are the alveoli are there, they are made up of simple squamous epithelium. In the space between clusters of alveoli is elastic connective tissue. So we have to expand. So that's the reason they are made up of elastic connective tissue, which is important for exhalation. Within the wall are macrophages. So this is very important. So in the alveoli, we have macrophages. What they will do? They will phagocytes. They will eat the macrophages. They will eat the bacteria, whatever come, or material, which were not taken away by the mucous membrane. Okay. There are millions of alveoli in each them. The total surface area is estimated to the 700 to 800 square feet. So what is the area of the lungs? No, sorry, or the alveoli, that is 700 to 800 square feet. Okay. Each alveolus is surfaced around by a network of pulmonary capillaries. So, primary bronchi, secondary bronchi, bronchial tree, bronchi is attached to the alveoli, and alveoli is attached to the capillaries, pulmonary capillaries. Recall that capillary is also made up of simple squamous epithelium. So there are only two cells between the air in the alveoli and the blood in the pulmonary capillary, which permits efficient diffusion of gases. So easily. So it is also made up of simple squamous epithelium. It is also made up of simple squamous epithelium. So basically, the connection between this is formed very easily, and the gases will from the alveoli to the capillaries will go easily. Okay, understood? So this is very important. Each alveolus is lined with a thin layer of tissue fluid, which is essential for the diffusion of gas, because a gas must dissolve in a liquid in order to enter to the to enter gas dissolve in a liquid in order to enter or leave your cell. So here we have the one tissue fluid in each alveolus. This is the alveolus. So in each alveolus we have the fluid, which is very important to travel the gas from one tissue to the another tissue. So the grasping of gases will easily happen. Although this tissue fluid is necessary, to create a potential problem in that it would make the walls of an alveoli stick together internally. Imagine a plastic bag that is wet inside. Its wall would stick together because of the surface tension of the water. This is just what would happen in alveoli. And inflation would be very, very typical. So what will happen if there is no tissue fluid? When like yeah, uh, you have one plastic bag. Example, this is the plastic bag. So this is the dryness is there. You can easily pump the air. If there is the wetness, what will happen if you if you easily fulfill the plastic with the air, what will happen? It will stick together because of the water tension, surface tension of the water. So likewise, if there is no tissue fluid in the alveoli, what will happen? The alveoli will close. Whenever there is air coming, then only it opens. But exhalation is not happening. So there's the reason we need alveoli, a tissue fluid. Now, this problem is overcome by pulmonary surface. A lipoprotein secreted by alveolar type 2 cells, also called septal cells. Surface mixes the tissue fluid within the alveoli and decreases its surface tension, permitting inflation of the alveoli. So, likewise, there is a tissue fluid. In the tissue fluid, we have lipoprotein. lipoprotein. Lipoprotein is secreted by alveolar. Alveoli cells only secretes this lipoprotein. What will they will do? They will decrease the surface tension. They will decrease the surface tension. So easily Air enter easily, air will go outside. Okay. So, alveoli. Let's see the alveoli. Here we have the alveoli. This is the these are the alveoli. Group or alveolus. One is single alveoli. We have the alveoli duct is there. This is the pulmonary capillaries who are attaching to the alveoli, and we have the arterioles and venules. Venules bringing carbon dioxide, and arteriole taking the oxygenated blood. So this is the complete picture of the alveoli. You can see that this is the alveoli. There's a space for the capillary. This is the capillaries are there. Okay, this is oxygen, carbon dioxide, to the microphages, type 1 cell, uh, elastin fibers, respiratory membrane, surfactant, tissue fluid, alveolar epithelium, capillary endothelium, basement membrane of capillary epithelium. So all these things are there. I think we'll do that. Next, how we breathe. So basically, there are the two mechanisms, that is inhalation and exhalation. I think we will talk about that tomorrow. Okay, this is long topic is that here, here we have the mechanism of next we have pulmonary volumes. If any doubt, you can ask this.
No, doctor.
No doubt. How is your cough? Is it
Yes, that's went off. My cough gone.
okay?
Yeah, you told to add a S10 and F1, right?
Okay. No.
Yes, sir. So I added that. So why, sir, S10?
Because of
I
the
know the reason.
metabolism, to increase the metabolism of the medicines in your body.
Okay.
F1, because I will study our mechanism, our breathing mechanism will work directly, indirectly. Directly, if you are the air is coming, but indirectly with the help of respiratory centers in our brain. Okay, respiratory center must be activated. So then only we will able to uh, we will able to breathe. We will able to uh, we will able to anything exhale, exhalation of here regulation of respiration. Continuously you are respirating now, so you have nervous regulation is there. So that's the reason I added F1. And we have any another one is chemical regulation. So both needed for continuously. Here you can see that this is the respiratory centers in the body. We will discuss in detail. So from that we have the area where we are able to breathe. Okay. So F1 will control. If there is problem in that area, it will control. S10 to increase the metabolism. Okay. That's like I added S10 and F1.
Okay, sir.
Anything else? Or else so I am planning